defense mechanism of the gingiva. Coming to the introduction, oral cavity. Oral cavity is a complex environment. The gingival tissue is constantly subjected to mechanical and bacterial attack. Factors that provide resistance to these actions comes under the defense mechanism of gingiva. So, what are these factors that help in defense mechanism? The gingival sulcular fluid, gingival epithelium, leukocytes, and saliva. Coming to the first factor, that is gingival clavicular fluid, which is also known as the gingival sulcular fluid. Why? Because it is found in the gingival sulcus, which is bounded by the tooth on one side and the gingival tissue on the other side. GCF is found in this gingival sulcus. So, what is this GCF? According to Brill, it is a transudate, that is, any fluid that has passed through a membrane or tissue, and sometimes it is associated with inflammation. According to Lowe and Weinstein, it is an inflammatory exudate, that is, material such as fluid, cells, or cellular debris that has escaped from blood vessels and it is deposited in tissues or tissue surfaces. That is also as a result of inflammation. And according to Alfano and Pashley, this GCF, it is initially considered to be an interstitial fluid, that is the fluid found between the cells of the tissue. And it appears in the gingival sulcus because of the osmotic gradient. And then later, because of the stimulation, it changes into an exudate. So initially, it is a pro-inflammatory fluid, which is earlier considered to be a transudate, and on stimulation, it changes to an exudate. So the composition of GCF and its possible role in defense mechanism was elucidated by Weyrhoff and Brill and Krauss in 1950s. The diffusion of gingival fluid in healthy gingiva is slow, but it increases during the inflammation. So, coming to the functions of GCF, it helps to flush out the injurious substances from the sulcus and also prevent the entry of bacteria into the sulcus because of its physical presence in the gingival sulcus. Because of the net outward GCF flow, it will inhibit the retrograde movement of the saliva into the sulcus. Now, it contains certain defensive proteins that help to protect against the foreign body attack. And also, it has a role in protection in areas, especially with less than 2 millimeter width of the keratinized gingiva. Now, coming to the amount of this GCF fluid. In strictly normal gingiva, there is little or no fluid to be collected. So even if the tissue appears normally, we can collect some GCF from the gingival sulcus. Why? Because microscopically, when we examine this gingiva, we can see that inflammation is present in that tissue. So the mean GCF volume in the proximal spaces from molar teeth is found to be in the range of 0.43 to 1.56 microliter. So what are the methods to collect this GCF? The first method is we can use absorbing paper strips as shown in this figure. We can use two methods. First is extraclavicular method as shown in the figure A, where the absorbing paper strip is placed in contact with the tooth surface and to the gingiva. Next is intraclavicular method, where we can either keep it just at the entrance of the sulcus, that is known as the superficial method as shown in figure B. Then we can insert it deep into the bottom of the sulcus, known as the deep method as shown in figure C. Next method is we can use a capillary tube or micropipettes whose diameter we already know. Because of the capillary action, the GCF will enter into these tubes. Next is using pre-weighed twisted threads. So we can use these threads and insert it around the tooth deep into the gingival sulcus. Next is using intraclavicular washing. This method is especially useful when we want to analyze what are the cells found in the GCF. Two methods are used. First is a 10 ml of this isotonic solution, that is example Hank's balanced salt solution, is injected into the crevice. Then using a micro syringe, then it is re-aspirated back. Second method is we can use a customized acrylic stent and keep it in the gingival tissue so that that particular area is isolated from rest of the mouth. And then this will irritate the tissue for about 15 minutes using the saline solution. And then using a periostatic pump, this fluid is collected back. Now, how can you evaluate the amount of GCF collected? First method is we can use, when it is in the paper strip, we can view it directly or using stains like ninhydrin, so that we can either linearly measure the presence of GCF in the paper strip, or we can assess the wetted area in the paper strip. Then next method is weighing the strip. The third method is using periodotron, that is based on the principle of capacitance. So when the paper strip is kept between the jaws of this instrument, it measures the electrical capacitance of the wet filter paper. Various models available are 600, 6000 and 8000. Now coming to the composition of this GCF. It contains various cellular elements, especially the epithelial cells, which can come from the oral sulcular epithelium or from the junctional epithelium. Then it can contain the leukocytes which have come from the blood vessels in the connective tissue of the gingiva. Then they move to the epithelium and then they come into the gingival sulcus. Then they can contain the bacteria from the plaque associated with this region. They contain various electrolytes such as sodium, potassium, fluoride, etc. Organic compounds like carbohydrates, lipids, and proteins. They also contain metabolic and bacterial products like lactic acid, hydroxyproline, urea, etc. Also some enzymes like acid phosphatase, alkaline phosphatase, etc. So these are the enzymes and other compounds reported in GCF. They contain acid phosphatase, alkaline phosphatase, then citric acid, various cytokines, then immunoglobulins, various endopeptidases, then exopeptidases, glycosidases, lactoferrin, lactic acid, etc. GCF has a role in both cellular and humoral immunity. Interleukin 1 alpha and 1 beta found in the GCF, they help it to increase the binding of the polymorphonuclear leukocytes and monocytes to the endothelial cells. They stimulate the production of prostaglandin. They help in the release of the lysosomal enzyme and stimulate bone resorption. Interferon alpha has a protective role in periodontal disease by inhibiting the bone resorption activity of interleukin 1. Now, coming to the GCF flow rate. During minimum inflammation, it is about 0.05 to 0.2 ml per minute. And during inflammation, this flow rate will increase. Now, what is the clinical significance of GCF? It follows a circadian periodicity, that is, from 6 a.m. to 10 p.m., the GCF amount will gradually increase. And also the presence of sex hormones, and during ovulation also the GCF flow will increase. Then mechanical stimulation of the gingiva, as during chewing, vigorous gingival brushing, or during gingival massage, the GCF flow will increase. Smoking causes an immediate, transient, but marked increase in the GCF flow. During the healing period after the periodontal therapy also, the GCF production will increase. Then, certain drugs like tetracycline and metronidazole are excreted in GCF, that is, they are found in GCF. So, these drugs are used in periodontal therapy. Now, coming to the second factor, that is the role of gingival epithelium. Gingival epithelium include three parts mainly. The first one represented as 1 in this figure, that is the junctional epithelium, which help to attach the gingiva to the tooth surface. Next is 2 in this figure, that is the circular epithelium, which line the inner surface of the gingival sulcus, and 3, that is the outer epithelium. This gingival epithelium is a continuous layer of stratified squamous epithelium. The predominant cell found here is the keratinocytes, and the other cells are known as non-keratinocytes, such as the Langerhans cell, Merkel cells, melanocytes, and inflammatory cells. Now, what are the functions of the gingival epithelium? It helps in protection. How? It seals the tooth, it seals around the tooth. Then it helps to withstand the frictional forces of mastication. Also, it acts as a barrier for the entry of various chemicals, water, microbes, etc. It has signaling function also. Also, especially the junctional epithelium and the circular epithelium are constantly in a state of renewal. So the turnover rate of gingiva is about 10 to 12 days, and for junctional epithelium, it is about 1 to 6 days. Also, these two epithelia are permeable to various substances like albumin, histamine, etc., and also for substances with a molecular weight of up to 1000 kilodalton. It also has various secretions like chemokines and pro-inflammatory cytokines, and also antimicrobial peptidases like defensin. Now coming to the third factor, that is leukocytes or the WBCs. The predominant leukocyte found in GCF is the polymorphonuclear neutrophils. The main port of entry of leukocytes into the oral cavity is the gingival sulcus. So the leukocytes are found in the GCF in tissue, that is gingival tissue, that is found to be healthy and also free of inflammation. And majority of these cells are viable and they have phagocytic capacity. In the GCF, the T lymphocyte to B lymphocyte ratio is about 1:3, which is just the reverse as found in the peripheral blood. So, in a clinically healthy gingival sulcus, about 91.2 to 91.5% of these leukocytes are PMNs, and mononuclear cells are about 8.5 to 8.8%. Now, the leukocytes in saliva, they contain all forms of the WBC. The principal cell is same as in the GCF, that is polymorphonuclear leukocytes. The leading PMNs in saliva are known as orogranulocytes. The rate of migration of these orogranulocytes into the oral cavity is known as orogranulocytic migratory rate. Now, the third factor is saliva, which is produced from major and minor salivary glands. The composition of the saliva, about 99.5% is water and 0.5% is solid, which can be inorganic factors and organic factors. Inorganic factors can be bicarbonates like sodium, potassium, calcium, or gaseous substances like carbon dioxide and ammonia. The organic factors can be protein, albumin, various enzymes, immunoglobulin, etc. So these are the functions of saliva in general. The main functions of saliva is because of the presence of mucin, proline-rich glycoprotein, and water, It helps in lubrication. Then the physical flow of the saliva itself clears the debris and the bacteria. The presence of bicarbonates and phosphates act as antacids, that is buffering action. It also has antibacterial action. How it contains various immunoglobulins like IgA, IgG, and IgM. Then enzymes like lysozyme, lactoperoxidase, and the iron-containing enzyme lactoferrin and myeloperoxidase. All these have an action against particular bacteria. It also contains coagulating factors like 8, 9, and 10. Thereby, the saliva help to fasten the blood coagulation and also protect the wounds from the bacterial invasion. So, now coming to the conclusion, all these four factors help it to keep a balance between the health and the disease in the complex environment of the oral cavity. Thank you.